We'll move on. I've already made a couple of references to India, so I'll hand the floor to Debolina Kundu, who I'm sure is going to talk about the Indian context. Debolina, the floor is yours. Welcome. You have 10 minutes.
Thank you, Shipra. I hope I'm audible.
Yes.
Okay. This is, I'll be presenting the impact of COVID-19 on the lives and livelihoods of the slum dwellers. This is I'll be presenting the rapid study of slum dwellers in 10 Indian cities and a few peri-urban and rural locations. And the evidence that emerges out of this analysis is basically a disruption in the urban-rural linkages. We had a vast team. This is a collaboration of World Vision India and the SHLC team at NIUA. As we know that cities are hotspots of COVID-19 and slums are the basic areas where because of inequality, the things are really worse. And India has more than 17% of the country's population living in slums. And with the lockdown measures, we are in the 4th stage of our lockdown. Measures have been taken to contain the virus, but supply chains have been broken, which again broke the urban-rural linkages. A section of the vulnerable people started moving back to the villages. And based on all these facts, we thought that it's important to understand the impact of COVID-19 on the poor and vulnerable. We are trying to build an evidence in phases. This is the results I'm going to present is the results of the first phase of the survey. When we look at the basic amenities in India as a whole, we find that slums are not in a very favorable position when we look at various basic amenities, and rural areas are much more distressed. And the latest data from the NSSO also supports this. The slums in India are not served with basic amenities to an extent where when we compare with the non-slum areas, things are much worse in the non-notified slums, whether we look at drinking water, bathrooms, use of latrines, or availability of soap and detergent in the washing places. The major themes which I tried to address is livelihood, food security, knowledge on COVID, women and domestic violence, access to basic amenities, which again influences social distancing, and education and health. The selection of cities was basically where World Vision has their interventions. This was done through telephone surveys, so which is a major limitation. We spoke to the slum dwellers for 15 to 20 minutes. The telephone survey happened in the last week of April and the first week of May. And we took the written consent, telephonic consent from them. There was also focus group discussion, and the sample was around 100 households from each of the 10 cities, and all 1157 households were interviewed, which was around roughly 6,000 people in all. The locations are shown on this map. I'm not reading through the name of the cities, it's all evident here. When we look at household characteristics, all major religious and social groups were represented. We had 32% notified slums and 16% non-notified. We had urban villages, 20% peri-urban villages, and others. We had 32% migrant households, and we also tried to classify the poor, updating the poverty line. We had 42%, 42.8, roughly 43% people below poverty line. If we take the 2011-12, the latest poverty line, and update it with the February 2020 data, we found a new emerging new poor or the moderately poor in urban slums, and also 30% people above poverty line. And when we look at the extent of poverty, it was basically the casual laborers who are extremely hard hit. We had a question on what is the principal source of income. So the casual laborers who were, as I mentioned, the class reporting the highest number of respondents. People were basically working in the service sector, followed by construction, transport, trade and hotel, and slightly on manufacturing, which was 12.3%. We also had self-employed regular wage earners and a small percentage of others. This you can see from Chennai, this is the vertical slum. The auto rickshaws are all standing because of the lockdown. When we asked that whether the principal source of income has been affected across households, the answer was yes. Around, I think everyone was hard hit, the self-employed and the casual laborers the maximum. And also, what was the nature of the impact was another question which was asked. So loss of jobs was the maximum, and many of them did not receive their last month's salary, and reduction of wage was also another. So the most hard hit was the casual laborers who lost their jobs, followed by self-employed. They are not very big entrepreneurs. They were all petty entrepreneurs selling stuff in their push carts. And because of the lockdown, because of the disruption of the chain of urban-rural linkage, I think they were most hard hit. And this is the scenario all across the cities. I'm not going into the details in the interest of time. The coping strategy which was resorted to by most of the households was taking money from their own savings and money lending from their relatives. And this is this you find all across the cities and as well as the peri-urban areas. Social distancing, the government is trying to really ensure social distancing, but as David mentioned, that is not possible. We find higher congestion in the bigger cities, lower congestion in the small towns and in the peri-urban areas, where the social distancing is being adhered to. People generally go to fetch water from the public stand post, and that is seen, the maximum percentage is seen in Kolkata, Hyderabad and in Kanchipuram. When we looked at the access to bathrooms, again, exclusive use of bathrooms was 66%, but this is because the figure from Mumbai showed 100% of the people had makeshift arrangements within their tenements. So that increased the figures. If we delete Mumbai, I think the figure comes down sharply. Same with regard to latrine facilities. Most of the households do not have exclusive access to latrine facilities. And as I mentioned in the beginning, a large section of the people went back to their villages. And these are basically the migrants who, the sedentary migrants who did not go back to their villages. We tried to work out the figures for various entities where we find they are not as well off as the sedentary population. And there are various estimations on the vulnerable migrants and the circular migrants, what is their share. The latest figure from 2011-12 is around 200 million, of which 65.7% constitute the rural-urban stream. And as I mentioned that 40 million to 140 million are the conjectures, the various estimations of people going back to their
1 minute, Debolina.
Rural areas because of this lockdown. Support systems have come in from the government, but that is not enough. What you'll have the presentation with you. We can discuss later if someone is interested. I'll just go through those policy implications directly. We find a new class, the new poor emerging very rapidly. Concerns of this vulnerable class needs to be addressed. And also there is need for real-time tracking of health and livelihood conditions of the people. There should be focus on health, housing, and basic amenities of the slum dwellers, so that social distancing is possible. I don't think that will be possible in the very near future. Poverty and job loss needs to be tackled immediately, and both lives and livelihoods are important. And this binary which we have between rural and urban, I think that needs to get to be diffused, and there should be efforts for integrated development with effective urban-rural linkages. Cities need to be more inclusive and mainstream the migrants, so if such a pandemic happens again, people do not go back to their villages in dire distress. Intermediate towns need to be promoted to develop seamless continuum of rural-urban linkages, and governance mechanism needs to be strengthened. Capacities across the government layers need to be developed, and data systems need to be improved to facilitate data-driven and evidence-based governance. I think I gave you too much of the stuff in the last 10 minutes. If there are any questions, I'll be happy to address. Thank you so much, Shipra.
Thanks, Debolina. Yes, you gave us a lot of food for thought, a lot of data, a lot of rich analysis. Thank you very much. A couple of things. I think you're absolutely right about this binary, and that's the focus of UN Habitat's work, the importance of diffusing this binary and looking much more at integrated territorial development, integrated territorial policy. The other thing that's interesting from your last slide is also the idea of intermediate towns and cities. So basically the development of a system of cities rather than relying on primate cities. So, you know, those that offer maximum opportunities, attract people from really far. And then this whole sort of, you know, the chain, when it's broken, it's dire. So I think that was very important. Also the point about what you were saying, that how are people coping? And the idea about coping strategies, using up their savings. I was talking on with a group of SDI leaders from across the world a couple of days ago in a meeting, and they were saying that what they're seeing is also that it's not just savings. People are also, because of the open-endedness of this crisis, they're also using up their capital, and they're also withdrawing out of savings groups. So we're not just looking at poverty now, but we're looking at poverty continuing and perpetuated poverty for the future because of these breakdowns and because people will take a long time to bounce back. So those are important issues that you've reinforced. Thank you so much again.